Hi there, everyone. Will Dupree here in the KXAN Live studio. We're about to hear a press conference from several officials from Austin and Travis County talking about the COVID-19 response and the stay-home orders that will be extended today. Let's take a listen.
Us talked publicly about a concern that we were seeing, and that was in relation to both a substantial increase in new cases as well as an increase in hospitalizations. And last week we had another discussion about our concerns that our primary indicator for staging the new hospital admissions was heading towards that number of 20. And we were concerned about it crossing over into 20. That happened last night. And, having looked at that, as well as a number of supporting indicators, we've made the decision to transition to a stage 4 in terms of risk in the Austin-Travis County area. I'm going to share some slides with you now to show you where we are and to give you a better idea of what that looks like graphically. So right now I'm showing you our new confirmed cases in Austin and Travis County. You can see this hockey stick appearance on the right side of your screen. Last week we had 799 new cases diagnosed in the Sunday to Saturday period. This represents a 90% increase as compared to the week prior. In addition to that, our doubling time, so the time it's estimated to take for cases to double in Travis County, transitioned a week ago from 44 days to 25.5 days yesterday, as indicated by this reverse hockey stick that you see on the right side of this graph. When we talk about that primary indicator, that new admissions 7-day moving average, you can also see that in the yellow line here. And again, we see that hockey stick appearance happening over the last 7 days. The new admissions for last week was 144 new admissions during that 1-week period, which was a 58% increase as compared to the previous week. Again, illustrating substantial concern that we are having a change and a surge in our activity in Travis County. And finally, I want to share this graph with you. We're looking at 3 different things here. The blue line is the hospitalizations, the current hospitalizations. The orange line is the current patients in the ICU. And the gray line is the current patients who require a ventilator or breathing machine. Again, we can see in the past week a substantial increase in each of these 3 measures, with hospitalized patients being 129 yesterday, which is a 50% increase as compared to the previous week. Those in the ICU, 52 admissions, which represents a 30% increase as compared to a week ago. And those on a ventilator, 29, representing a 16% increase as compared to last week. Now, I want to be very clear about something, and that is our hospitals are in good shape right now. We're not talking to you today because we're concerned that there's an impending threat in the next week or 2 weeks that the hospitals are going to be overrun. We want to make sure that folks, if they need health care, that they go seek health care. If they have a condition that requires an emergency room or hospitalizations, they should not delay that because of the COVID concerns. If they're awaiting immunizations or physical examinations or other preventative care, they should also not wait. Now is the time to go do those things. Now is the time that we have plenty of hospital capacity. But the conversation today is about a concern for what is 3 or 4 or 5 weeks in the future. As we've seen in other jurisdictions who faced similar exponential increases in cases, it can be a very short period of time between when the situation is okay and when the hospitals become overwhelmed. So the conversation today is about behavior change. It's about what we can do as a community to flatten this curve again. We did a great job in March and April and May to get this flat, to really drive down the number of new cases, the number of hospitalizations, in ventilator and ICU usage. And we need to do that again. And so what that stage 4 means for us is we need to be a bit more cautious. It means that those who are over the age of 65, those who have significant underlying health conditions that are known to cause complications from COVID-19, including diabetes, heart disease, lung disease, kidney disease, and a number of other items which is on our CDC or our austintexas.gov/COVID-19 website. Those folks need to stay home. They only need to go out if it's absolutely essential that they go out. And if they do have to go out, that they wear a mask 100% of the time, that they social distance 100% of the time, and that they pay attention to the personal hygiene messages, the washing the hands, the not touching the face, and the associated messages. In addition to those individuals who are at risk themselves, we offer the same advice for those who live in households with those individuals. It is really, really important that we protect those who are the most vulnerable in our community. And if we do that, we can tolerate increases in cases without the substantial increase in hospitalizations and deaths. We are recommending that folks who are in that high-risk category not participate in social gatherings larger than 2, particularly in those circumstances where those social distancing and masking is not taking place. For the rest of the community, we're recommending that that threshold be at 10, unless those social distancing measures and the masking are able to take place in those settings. Again, it is critical for us to take appropriate actions now as a community to protect ourselves, to protect our household, and to protect one another. And, you know, we've seen quite a bit of interest and focus and really celebration of working together as a community when we've seen the issues facing our communities of color. And, you know, the concern for us right now in particular for COVID-19 is the disproportionate impact it is having on our communities of color. If we want to show solidarity with our Latinx community, with our African American community, then together we will take these steps necessary to protect all of us. And with that, I'll pass it to Sarah Eckhart.
I'm going to be completely straight with you all. The mayor and I and Judge Bisco completely recognize that the governor of the state of Texas has taken away from us enforcement authority to put into place adaptive measures that have proven to be effective in COVID-19. And the governor has also shown every intention of getting back to business as usual, irrespective of the facts that you've just heard from Dr. Escott. But we know our community, and we know that we in Austin, Travis County, and all the municipalities inside Travis County, as well as our neighbors around Travis County, are ready, willing, and able to make the adaptations necessary to keep our coworkers safe, to keep our neighbors, and to keep our families healthy, and that we will do what's necessary in order to safeguard our community. And so I'm asking for everyone to recommit today to the 6-foot distancing, to wearing those face masks, and also to not go out to places or go out with people who are not equally as committed to that 6-foot distancing and that face masking so that we can keep our whole community safe. So I do want to say that based on what we are seeing coming out of the University of Texas, and it has been very accurate up to this point, that by maintaining our 6-foot social distancing, by wearing our masks, and also by not going to places or going with people who are not equally committed, we have a high probability of being able to cut the numbers of deaths in half. That is an awesome power that we have. And I'm asking you to take hold of that power and use it for good. With each day that we delay in a recommitment to 6-foot distancing, as well as masking, and to staying away from places and people who are not doing the social distancing and the masking. Every day we delay, our probabilities of saving lives is going down. So again, I'm going to be completely straight with you. Please believe us. And please, everyone who can, stay covered so that we can stay open. And with that, Mayor?
Judge, thank you. So we talked last week about getting to 20 new hospitalizations on the 7-day rolling average. And honestly, frankly, we have gotten to this place sooner than I thought that we would. When this virus comes, it's going to come fast. It's going to come faster than any of us can imagine. And with passing 20 yesterday, we're getting that first early warning sign that this virus is still here, that it's coming at us, and that it's going to come more quickly than we can imagine. You know, our numbers in Austin have begun to geometrically increase. On our current path, more people are going to get sick and are going to die than would happen if we don't wear face coverings and we don't maintain 6-foot distancing. We each need to look into ourselves right now to make the individual choices that will indicate to ourselves and to others what we personally value. We have a virus that is disproportionately going after people who are over 65, disproportionately going after people who have a pre-existing condition, cancer, diabetes, obesity, other things. It is disproportionately going after our community of color. By the individual choices that we make and what we do over the coming few weeks, we get to decide for ourselves how important it is for us to protect those people, our neighbors, in our community. There are a lot of people in this community right now saying that Black Lives Matter, because they do. You have to decide now by your actions whether you mean that, whether that in fact is something that is more than a slogan, but is something that you're actually willing to put into practice. So there's a great debate in Austin right now about, do we want to open up the economy on the one hand, or do we want to be concerned about the virus on the other? And that's a false choice, because we want to try to open up the economy. We want people to be able to go out. We want people to be able to shop and to go into restaurants. We want people to be able to go to concerts. We want these things to happen. I would suggest that we can do those things, if that's the choice you make, and still wear a mask and still maintain 6-foot distance. The way that we do both, that we open up the economy and we protect against people dying and getting sick that don't have to, is by making the really simple choice to maintain 6-foot distancing and to wear masks. We have to be particularly careful about cocooning those populations that are most at risk. People in our nursing homes, communities of color, people with pre-existing conditions, those over 65. The scientists tell us that with this geometric rise, that we're going to run into more and more people that have the virus, maybe don't know they have the virus, that can infect us. They infect us and we don't know we're infected, we can pass it on to others, those that we love, or those that somebody else loves. It is no longer really safe for people over 65 to be going out, and that's why Dr. Escott talked about the increased for folks over 65 not to be in large groups, or even groups over a couple people. And today we are extending our order and putting in that provision for people over 65 and people that are susceptible. We are making a change in our order. The order section 4, I think we have some language that's going to be posted here shortly. But it talks about reopened businesses. And the new section 4 of the order says that while the city of Austin declared to be in stage 4 alert or higher, all businesses and operations reopened by the governor's executive order are strongly encouraged, since we can't mandate it, are strongly encouraged to operate at a minimal indoor capacity, maybe getting to 25% or below, provide services remotely or in a manner maximizing social distancing, curbside pickup, delivery, as much as possible. We want everyone to put the greatest effort to minimizing groups as much as we possibly can. And then perhaps most importantly, the last sentence of that section says that despite the issuance of the governor's order, local conditions continue to exhibit an alarming upward trend of the virus, as you've seen in the numbers. Therefore, businesses are encouraged to do everything that they can. Encouraged because we're not making it mandatory given the governor's order. Everything that they can, we're asking businesses beyond the requirements of the governor's order to require social distancing and require face masking behavior. What that means for each of us is we get to decide. You get to decide. Go into a concert where people are not wearing masks. You get to decide. Go into a store where people are not wearing masks. Remember that the people around you that are not wearing masks are putting you at risk. Who are not wearing masks are putting at risk people around them. And if you don't wear a mask, then you're putting them at risk. But you get to make the choice. This community gets to make this choice. We get to decide how important it is that we try to protect those around us. How important is it that we want those around us to try to protect us? I'm going to repeat something that Dr. Escott said because it's important. Right now, there's a lot of capacity in our hospitals. We're concerned about what's going to happen several weeks down the road. But right now, there's capacity, and they're very safe. So it's a good time to take care of ourselves and those we love. If you've been considering getting a physical or having a procedure done or going to the hospital or having something checked, now would be a good time to do that because there's a lot of space. Everything is really safe. This virus is going to be with us for a while. Our ability to be able to live lives as normally as we can and protect against the virus comes down to two really simple things. Just how inconvenient is it really to put on a face covering? Just how hard is it really to try to maintain 6 foot distance? We get to decide now. I hope that everybody's going to put forth the effort. I hope everybody will work to protect one another. And with that, I think that we're all available to answer questions.
Yes, at this time, we'll go ahead and open it up to our pool reporter to begin the question and answer segment of this press conference.
Good afternoon, everyone. My name's Betty Cross. I'm with CBS Austin, and the first question is from CBS Austin. Have you traced any of the growing number of new cases to common origin points? What locations do they have in common? And are you seeing any of these more recent cases trace back to protest or trace back to even restaurants? What I'm asking this is really to try to give our viewers some way of knowing what they can and can't do as they try to figure out how to navigate where they go from here.
So Betty, our case investigators are working hard to track down cases, but the challenge that we have right now is that people have, the positive cases that we're investigating right now have been to so many different locations. Work sites, grocery stores, restaurants, bars, that it is very, very difficult to pin it down to one particular location. And I want to state quite clearly, we have widespread community transmission in Austin, in Travis County, across Texas, and across the United States. So the risk of transmission is everywhere. And I don't mean that to frighten people. I mean that so they understand the facts. And the facts are, it's everywhere. And we're seeing that demonstrated in the new cases that we're experiencing and the rapid growth of those new cases. So if the question really is, where do I need to be careful? It is every time you go outside the house. That's where people need to be careful. We are also working hard to identify additional strategies to protect people within households, because we are seeing a number of clusters in households where we have 5 or 6 individuals in a single household that are all positive. And again, our concern is particularly in those larger households that tend to be in smaller dwelling sizes, those multi-generational households where folks really do have a hard time social distancing and protecting themselves from one another. So we have a long way to go when it comes to those case investigations and the disrupting that household transmission. But our teams are working hard on that.
So the question was, what do people do as they're trying to figure out how to navigate this? It's really pretty simple. Wear a mask when you go outside, and don't go places where people aren't wearing masks.
And I guess part of my question, not to take too much time with this, is we've opened up restaurants. You can't wear a mask when you're at a restaurant. Yes, you have some idea of social distance, but not with everyone. So I'm trying to give people, if we can in any way help them through tracing, to figure out where are some points where a lot of people seem to be vulnerable. Have we figured that out at all?
I think what you're hearing from Dr. Escott and from the mayor is the answer, although it's not the answer we want to hear. The answer is COVID-19 is transmitted person to person. You can't avoid it by avoiding certain places. You can only avoid it by adapting your own personal behaviors. So the governor is not going to allow us to slow down or even reverse a return to business as usual. So our best response as a community to COVID-19 is to adapt our behaviors, because we will not be able to avoid it by avoiding certain places. We will only be able to slow the spread of this virus by adapting our own behavior.
And with respect to restaurants, I think make sure that you don't go to a restaurant where people are not really seated separately, and make sure that you're just sitting with your core group. Make sure you're wearing your mask to and from the restaurant. Make sure that everybody in the restaurant, servers and the like, are wearing their masks.
Thank you. The next question is from Estonia. What is the current hospital capacity in the 5-county Austin region? Is it still hovering around 50%? I think that's for you, Dr. Escott.
So our capacity right now, occupancy is about 70%. Again, a small percentage of that is right now occupied by COVID-19 patients. So when we looked at the models, and the thresholds for transition from stage 3 to stage 4, the estimation is that we would have 1,100 beds to dedicate to COVID-19 patients. As we've done all along, we're continually reevaluating our metrics and our data because the data that we have may change those transition points in the future. We think we have 1,100 beds now. Our hospitals are reevaluating that to determine if that number can be raised. Similarly, our data streams that are coming in help us inform us about the rates of hospitalization, about the length of stay of hospitalization. And all those factors go into the model to determine when those appropriate trigger points should be and what they should be. And I bring that up because we may find that in a week or 2 weeks, we tweak those trigger points based on that new information. The early data that we have right now based on our hospitalizations that we've seen so far suggests to us that most hospitalizations are relatively brief. We've got about 50% of our hospitalizations which are 4 days or less. And about 75% of those are 9 days or less. But we still have some which are prolonged for 30, 60 days, sometimes longer. So all that information will be fed into the models to better inform our predictions for the future.
The next question is from KUT. What exactly do stage 4 restrictions mean for the public and for the healthcare system?
So the stage 4 really, and this is all on our website with our staging matrix. Really, the critical changes are the advice in relation to gathering sizes. If you remember, all the stages involve the masking and the social distancing and the personal hygiene. And there's going to be variation based upon whether or not an individual themselves or in their household is at higher risk for complications. For those individuals, they need to be more protective. They need to take less risk. And that's the things that I spoke about earlier. That is limiting gatherings to 2 or less. That's eliminating social gatherings that aren't essential, particularly those, as Sarah Eckhart said earlier, that don't involve protective behaviors, the masking and the social distancing. For those who are at lower risk, that threshold's a little higher. That's 10 individuals in a gathering space. This is, again, not about shocking people. We don't want people to live in fear. We want them to be smart. We want them to understand the evidence and be informed when the situation changes. And quite clearly, the situation has changed in Travis County in the last week. We've seen an increase in hospitalizations. We've seen an increase in cases. We've seen an increase in the ICUs and the ventilator use, and substantial change in our doubling time. These are all warning signs. And we are empowered to make the change. We are empowered to flatten the curve again. And if we follow those guidelines and the staging criteria in the category 4, stage 4, the orange stage, then we have a better chance of flattening that curve again.
The next question is from Co-op Radio. What guidance, if any, have you received from the state and/or federal government in response to the dramatic uptick of hospitalizations across the state?
I will tell you that Judge Wolf in Bexar County sent a letter to the governor's office late last week requesting authority to enforce masking. Since face masking does appear to be very low-hanging fruit that everyone agrees with, including the governor. And so Judge Wolf did receive a response from the governor's office that the governor would not provide local authority to enforce face masking, although he too agreed that it was a good adaptation. So that was disheartening.
I'll also add to that. I don't think that anybody wants massive amounts of hospitalizations and deaths. But the simple fact is right now that we are not the only ones facing surge. We're not the only ones with that hockey stick appearance that I just showed you. Bexar County's in a similar situation. Tarrant County's in a similar situation. Dallas County has cases per capita right now, new cases that are 50% higher than ours. We're seeing this across the metropolitan counties in Texas, and certainly we've seen in other states like Florida. The reality is that what's changed is the messaging. What's changed is that desire to really push forward with the economy while sacrificing the public health piece. And again, as Mayor Adler said, it's a false choice. We don't have to choose one or the other. We have to choose both. And those simple things, the masking, the social distancing, the personal hygiene, is how we achieve both. So I really do not understand, as a public health official, as a physician, why we cannot all get behind those simple things so that we can do both effectively.
The next question is from the Austin Chronicle. Does the city have enough contact tracers hired and trained to respond to the surge we may now anticipate?
So Austin Public Health is in the process of, every week we're onboarding more people. It's around 10 people a week that are coming on board, that we're training, that are taking on new cases. We also have a partnership with the Dell Medical School, with Community Care, and we're looking for additional partnerships to help carry that load. I will say that it's not all about the contact tracing. And let me explain that a little bit. One of the challenges that we've had over the past week or so has been a delay in the results due to a substantial increase in the testing done across our jurisdiction and across the state. It's not uncommon for us right now to be notified of a new case, confirmed case, that was tested a week ago, that had onset of symptoms 3 or 4 or 5 days before that. So the challenge is right now, when Austin Public Health is receiving a case, that individual may not be infectious any longer. In some circumstances, the same day that we report a new case, we report that same case as recovered because it's been more than 14 days. So this is why it's critical that we all engage in those protective behaviors, that masking, that social distancing. Because we cannot capture everybody with contact tracing. We cannot protect everybody with contact tracing. We have to protect each other. We have to protect ourselves and our households and our community by doing those things which we know are going to work.
Our next question is from KXAN. Using contact tracing, how many people have been successfully tracked and quarantined? How many people not living with a known case have contact tracers been able to contact and tell them that they need to quarantine?
I don't have a number for that. I can try to get that number. It's got to be thousands. Remember, we've had some cases that have had hundreds of contacts that had to be contacted and advised to quarantine and be tested. So it's going to continue to be a process. We are advising people as soon as the case is diagnosed. In addition to the instructions that we provide once we receive confirmation of the case, we have a testing collaborative. So the individuals at the time that they're tested are also notified, particularly if they're symptomatic at the time of testing, or if they've had a positive exposure at the time of testing, that they should be self-isolating from that point in time onwards until they receive a negative result. So we are trying to push that contact tracing, or at least the information regarding the need to isolate and protect others way back to the point of testing, so that we don't miss out on opportunities to isolate people.
The next question is from the Austin American-Statesman. Does city or county leaders have any plans to contact Governor Abbott about statewide rules that render these local orders unenforceable? Do you expect at any point to actually be able to have an impact through these local orders, considering what is taking place statewide?
Yes, and we hope so.
I'm in contact with the governor's office as we talk through these issues. I think the governor's office is in contact with cities and large urban counties around the state. Also visiting with mayors in some of the large cities that are looking at increases the same as ours. I think that as cities we may formally request of the governor that he give the local agencies, cities, the opportunity to enforce masks. It just seems like such an important thing to do that is so consistent with and doesn't interfere with the opening up of the economy. But ultimately, the governor will decide what the governor does. But as a community, we get to decide what we do. Everyone gets to decide on their own if they wear a mask or not. And everyone gets to decide if they go into an establishment where people are not wearing masks as much as they can. We get to decide as a business owner whether we tell people they should wear masks when they come into our business establishment. We each get to decide, and our individual choices will add up to whatever it is that our community.
The next question is from KView, and I know you all have touched on this a little bit today, but I think she's specifically asking what particular measures, beyond just asking people to wear masks and to continue to maintain 6 feet of social distancing, what measures can city or county leaders plan to use since these orders are basically unenforceable?
That is a very, very painful question. Without enforcement capabilities, we are reliant on our community choices. But we know this community. The best that we can provide as government officials is the best information to all of the members of our community so that we can all make the best individual choices. The governor has very plainly spoken in his response to Judge Wolf that he believes that personal choice will carry us through this better than regulation would. I disagree. I think the mayor disagrees as well. But the message has been very, very clear from the governor's office that we are reliant on individual choice. And so the best we can do is to provide you the most accurate and timely information so that you can make the decisions for yourself. And we have before, and we will again. So again, I know it feels unsatisfactory, but the best information we can provide is maintain your 6 foot social distancing, recommit to the masking, and don't go to places or with people who are not similarly committed.
I just want to add on that. Some businesses are doing a great job at really helping us protect their employees and protect the community. I went to Costco this weekend with my wife for the first time in a long time. They had a big sign at the door. You must wear a mask to come in. And 100% of the staff were wearing masks. 100% of the people shopping were wearing masks. And we need more of that. We need more businesses making the decision to say it's okay to want to protect my employees, to want to protect the community. And I think we really do need to applaud those businesses that are doing well, doing their part, not only to protect people while they're in their business, but also to remind folks that it's the right thing to do. It's what we have to do as a community to get through this. And my hope is that more businesses will request that people wear masks to come inside, and that we will be able to flatten this curve again. It really is to save lives and to save those that are the most vulnerable in our community. I think it says a lot about a community when we see what lengths people will go to protect those who are the most vulnerable. And I'm very hopeful for this community.
You make a good point, Dr. Escott. I would really like businesses that are doing this to reach out to me in my office so that we can let the community know who it is that are really stepping forward to try to protect their employees and the rest of the community. I know that HEB is doing that as well. So if you're an employer and you're doing this, please reach out to my office so that I can elevate your business as well.
We have a question now from Community Impact. You commended local residents for flattening the curve early this spring. Why have circumstances changed? Is it reopening, warmer weather, a general fatigue with staying indoors? Why are we as a community not taking this seriously enough?
I think we all want to go out. Oh, we've all been inside for so long. We miss people, we miss activities. And then we also, businesses are missing the income. Restricting the economy is incredibly hard, not only socially, but economically, the impact on business. For all of those reasons. But that doesn't make it something that we can sustain. We cannot sustain either locking down and not having any interaction, nor can we sustain everyone not wearing masks and everyone not social distancing, because it'll be thousands and thousands of people that ultimately die. We can't sustain either of those two things. I think that people are not meeting in the middle now, those that are not, in terms of doing the opened activities, but wearing the masks and doing the social distancing. I think that's not happening because people are getting conflicting messages. They don't think that it's important. They're watching the messages coming from the national government. They're watching what has become all too politicized discussion about the virus. And it's hard to push all of that politics away and aside. Actually pretty simple. You wear a face covering. It increases the chances you won't give the virus to someone else. If people wear face coverings around you, it increases the chance they'll give it to you. You can still do the reopenings. Just wear the face. It's pretty simple, and I think people aren't doing it because they're not convinced that it's necessary, but it is.
Fox 7 asks, are there any plans to place hospital tents in parts of the county if ever needed?
We do have a medical surge plan that we have, and this is something I'm so grateful to this community for. By flattening the curve early on in the progress of COVID-19, it gave us the time necessary to put together the medical surge plan and to identify all the resources, the locations, and the personnel necessary. So yes, we do have plans in place, and we continue to work in partnership with our major hospitals and all of our provider network to assure that we will be able to surge beyond the hospital's regular capacity when that time comes. Given the trajectory that we're currently on, we do. I will just speak for myself, and we'll hear from the doctor. But I think the probability is that we do. We will need capacity beyond our regular hospital capacity at some point, probably this summer.
Yeah, again, as Sarah just said, we've got plans. We've got plans to surge within the walls of the hospitals, so doubling up on beds. If it's a single occupancy room, making it double occupancy. expanding to non-clinical areas within the hospitals, and then expanding outside the walls of the hospital to other locations. It's a plan. We have a plan. We've prepared to exercise those plans and implement those plans. But those are not plans that we ever want to implement. Because you can imagine you can't care for somebody as well in the cafeteria of the hospital as you can in an actual hospital bed, in a hospital room with oxygen supplies and nursing staff and so forth. The state's plan is a reasonable plan. It calls for the similar steps that we've been preparing for quite some time. But the challenge is that surge plans tend to work if one jurisdiction is experiencing surge, but they tend to fail if Austin is surging and Dallas is surging and San Antonio is surging and Houston is surging all at the same time, because there simply are not enough resources and there aren't not enough people to staff those beds. And this is why we need people to really think about what they're doing. We need them to act. We need them to modify their behavior again, so that we can prevent that from happening. We will handle it. We will take care of it. We will look after people. We will care for people. But we want that to be in the ideal situation where we have enough resources for them, enough personnel to take good care of them. And we're hopeful that the community will be engaged in this mission with us together to flatten the curve again, like we did so well in March and April.
Univision is asking, what did you learn from the forum this past weekend geared towards the Hispanic community? How will the city and public health officials better assist and outreach to the Hispanic community, people who have been disproportionately affected?
I think we learned a lot this weekend, not only from that forum, but from all the conversations that are happening. We know that the Latinx population is one that we need to focus on. We know that the ways that we've been communicating to that community have not gotten to everyone. We know that we need additional tools. We need additional ways for people to be able to isolate, perhaps in facilities if they can't isolate at home. We need to do a better job of getting personal protective equipment into those homes to help people better isolate from families if they're not able to isolate otherwise. We know we have to do a better job of getting the message to people. We know we have to do a better job of getting a trusted message to the community, where the community members hearing it, don't feel like they're at risk. This community, because of its susceptibility, because of the numbers, is one of the highest priorities in the city right now. And there's a lot of things that we're doing now and follow up to that associated with an overall strategy for tackling this outbreak in particular.
The next question is from Co-op Radio. What insights on infected individuals' behaviors are you gaining through hospital admission interviews? How are those insights informing risk-based guidance to residents, employers, and businesses?
So again, our teams are working on the contact tracing and the cluster investigations piece. I think right now we are still seeing folks that may not have been aware of all the symptoms of COVID-19 and therefore may have gone to work or to other social gatherings despite having symptoms. And so it's important right now that folks remember that it's not just fever and cough like we talked about back in February and March. It's all sorts of other symptoms as well. It's nausea, it's vomiting, it's chills, it's muscle aches, it's change in smell and taste, it's diarrhea. There are many, many symptoms now. And that's why one of the most critical factors in that personal hygiene guidance that we provide is to stay home if you're sick. If you have any symptoms that could be associated with COVID-19, stay home, go to our website and schedule a test. We are also seeing some increased concerns from those who we're contacting who are hesitant to share information about where they work or where they've been. I think to some extent there may be some shame that's involved. I think people are concerned that they may have exposed others. And I want to be very clear that when we do those case investigations, if we learn or get a list of an individual, of folks that they've been in contact with, we never ever say that person's name. We simply say, you were exposed to COVID-19 and you need to get tested and you need to isolate yourself. It's anonymous information, just like with our HIV investigations, our sexually transmitted diseases investigations, and every other public health investigation. People should feel very safe that the information is secure, that it stays within public health and is not shared with anybody else.
And that was, oh, go ahead, I'm sorry.
Were you about to say that was our last question?
Yes.
Okay, good.
That is our last question. Thank you so much for answering all of these questions. I know we have a million more, but it'll have to be on another day.
Thank you very much.
Thank you.
Thank you.
Everyone be safe.
Stay covered, stay open.
Will Dupree once again here in the KXAN Live studio. You just heard the conclusion of another press conference called by the interim health authority for Austin Travis County, Dr. Mark Escott, Austin Mayor Steve Adler, and the former Travis County judge who is now the special assistant to the current county judge, Sarah Eckhart. What they were talking about is that there is a troubling trend happening here in our area, showing not only an increase in new cases of COVID-19, but also hospitalizations because of it. What the situation is right now here in Austin, and I want you to take a look at these numbers. If you can see right here now, there are more than 4,500 new confirmed cases. What the interim health authority said a few moments ago was that there is now a 90% increase from the previous week of new cases. 799 alone just last week, and the doubling time has been cut in half, meaning it's taken that less, it's happening much faster. The number of cases are doubling here at Austin Travis County, which does give pause for many people here, officials and health experts for sure. More than 100 deaths now from COVID-19 in Travis County. At least 3,400 people have recovered after receiving a positive diagnosis, but on the right side of your screen there, that's what's worrying a lot of people, at least from the officials' standpoint. 129 people are now hospitalized because of COVID-19. 52 people are in intensive care, and 29 people are now using breathing machines, ventilators, to help them as they deal with this virus. So I'm going to leave those numbers up just for a moment as we continue talking about what's happening here. So because of that, hospitalization has gone up so quickly, and I want to show you really fast another graphic that the city and county have put out there. If you take a look right here, this is the dashboard for hospitalizations, and on the left side of the screen there, the 7-day moving average for new hospital admissions is now over 20. So we have now moved into the stage 4 in terms of those risk-based guidelines, which is in the color orange there in that graph that you're seeing right there in the middle of your screen. So what that means is that it's asking people, encouraging people to take certain precautions. There are no enforceable things that the city and county can do to try to protect people because the governor's plan has eliminated that ability. However, because of what the risk level is, the city and county can encourage people to do certain things. And that means now that we're in stage 4, that people who are over the age of 65, who are medically compromised, sick, have pre-existing conditions, should stay home if at all possible, wear masks 100% of the time, as the officials said, and maintain that 6-foot social distance from others 100% of the time. For those of us who are lower risk, for who are healthier or younger or something like that, they're saying still wear a face mask and maintain social distance of at least 6 feet. Additionally, if you are going out and people that you are surrounded by or going to businesses that are not following that same thing, the officials are saying to remove yourself from that and try to avoid it as much as possible, because what they are wanting not to happen is that the hospitals will be overwhelmed. They did say hospital space is in a good place right now, but what they're worried about is several weeks down the line of what that might look like. And these numbers right here are the trouble signs, the warning signs that officials are looking at. Just if you look over again on the left side of the screen there, 30 more people went into the hospitals today. That's just today here in Austin and Travis County. So please keep that in mind. We will have a full write-up of all that was discussed during that press conference just a few moments ago on our website, kxan.com, and on the KXAN News app, so please download that. We will keep providing updates about this situation because it is not over. That point cannot be underlined enough at this time. So again, if you're going out, wear your face mask. I have mine right here, so I'm in an office that's kind of set aside from our newsroom, but when I leave this space, which is self-contained at the moment, and go back into our larger newsroom, I put that mask on to protect people, because a lot of people are not showing symptoms even though they may have COVID-19. Keep that in mind whenever you're going out, because you are not only going to be protecting yourself, but other people wearing masks are going to protect you. It's all about that kind of community care, that community spirit to be able to protect each other, and that's what the officials just spoke about here a few moments ago. Once again, we will have a full update on our website, kxan.com, and the KXAN News app. You can find it there. Please, everyone, stay safe and stay healthy, and we'll talk to you another time.